So as we have discussed, all laparoscopies are done under general anesthesia. So patients need fitness for that. So you need a laparoscope, you need a monitor, you need a camera, you need an insufflator, and you need instrumentation for doing laparoscopy. So you need to make ports, and these instruments will go through the ports. So you need meshes and you need tackers. Tackers are the fixation devices. So this is all what is required to do the hernia surgery and how it is done. It is very important to understand that the OTs have to be very sterile because we are putting in foreign body inside. So they should not get contaminated with any infection. So surgeons always change their gloves whenever they start handling the meshes. So fixation is very important, otherwise the meshes can migrate, meshes can roll, because we roll the meshes like a cigar and push them inside the abdomen. So these can acquire a shape in which they were rolled. So fixation is done minimum at 2 places so that these meshes cannot roll whenever we are doing an inguinal hernia. But fixation devices are multiple whenever you are doing a ventral hernia, because in inguinal hernias you put the mesh in a pseudo space, and in ventral hernias the meshes are normally intraperitoneal. So intraperitoneally you have to fix them nicely to the abdominal wall, and we use special kind of meshes which has 2 materials. The one on the abdominal side should get stuck to the abdominal wall very nicely, and the other side should be pliable so that the intestines do not get stuck to that wall. So these are special meshes which are specially made for intra-abdominal hernia surgeries, that means ventral hernia surgeries.